Okay. Grace, go ahead. Introduce yourself, please.
All right. Well, I'm Grace, and I'm the Child Life intern at Mercy Kids. And how many of you guys have heard about Child Life or know what a Child Life specialist is or does in the hospital setting? 2?
Heard of it.
Heard of it? Okay, I'll give you just like a brief synopsis of what Child Life is. But Child Life, basically, we work with the pediatric population in the hospital setting, and we provide therapeutic play and procedure preparation and distractions for our pediatric patients that are undergoing procedures and new diagnoses. And we just kind of try and eliminate some of those hospital stressors and provide like opportunities for them to express themselves in different ways. So I will go ahead and just continue to start. So I'm going to just start with like thinking about remembering when you guys were teenagers, or if you have teenagers at home, and how everybody, like as a teenager, you are constantly surrounded by your family and your friends. You wake up, you go to school, you're surrounded by your friends, you go home and you're with your family, and just how every aspect of a teenager's life is revolved around their peers or their family. So teens are in the stage of development where their identities and their peer groups are very important to them. So their peer groups are more important to them than their families. So they're in that identity versus role confusion stage where they are trying to find out who they are. They're in that transition from being an independent teen to also being still dependent on their families, and they're in that transition of trying to figure out who they are and where they fit in. So it's important to them to constantly be surrounded by their family and surrounded by their friends to try and eliminate some of the stress that they undergo. So some developmental considerations and potential stressors that teens may feel while they're in the hospital setting are self and body images are threatened. So they might, if they're here for like an amputee or something like that, then they're gonna struggle throughout that process of trying to figure out who they are without that piece of them. Fear of mutilation, fear of death and disability, loss of control, loss of privacy. And then these last 4 really revolve around their peers and their family. So separation from peers, school concerns, extracurricular activity concerns, and increased family conflicts. The handout that I gave you does give you some suggestions of what you can do to combat these while they are in in your facility. So like for self-image, journaling and drawing can really help process through some of that stuff. Fear of body mutilation can also be through journaling, and then prep time for therapy. I'm not sure how much time you guys give your teens before they do their therapy, but making sure that they have time to mentally prepare before they start doing speech or physical therapy or stuff like that. Loss of control and privacy. We like to give our patients as many choices as possible, so if they do have the opportunity to pick a choice in the morning to do their therapy or in the afternoon, or try and kind of figure out when they can do their homework or when they have family time and friend time, trying to give them as many choices as possible. The separation from peers, if it's possible to maybe invite a friend during their therapy, if they can, just to have some support. I know that every patient's different and every situation's different, and patients may not want their friends here because of a certain reason, or they may not need their family, but to give them those options and see if they would like to have a friend or peers visit if they can. Some school concerns are having open communication with their counselor or their teachers if they're having questions about their homework or they are unsure of what they can do. Having that communication is going to really help. And then building a routine, so maybe having a scheduled time for homework, and they do their homework then, and then they can have downtime in between therapy and stuff. Extracurricular activities. I was a dancer in high school, so one of our dancers was not able to make practice for a week, and she just FaceTimed. She didn't actually get to dance, but she was there and hearing our what's the word I'm trying to think of?
Routine.
Yeah, hearing the feedback from coaches and stuff like that. So she was still present with us, but not actually there. So if they are a part of band or soccer or something, and you can get them to FaceTime with their team or their group that could help them as well to try and still feel like they're a part of the team or their group. And then family conflict is always having like our families like validate the patients and listen to their feelings and just be support for them as well. I do have a video. I'm gonna say a few disclaimers. There is like some cuss words in there. This is a scene from Grey's Anatomy if you watch the show. It's about Arizona talking to a teen patient, trying to get her to get out of bed and do whatever it is that she needed to do. I haven't seen this episode in a while, but I do remember they tried a few different things with her. And Arizona's approach, I'm not saying is what you guys should do because it's not within our like rules, but it's a good like kind of video just to see different approaches and stuff. I have to find it, hang on.
Her approach is my approach.
Can you hear that? Can you hear it?
If we're quiet, but it's
Okay. Do you want to pause it first?
Get up now. I need to take a few steps and remember how it feels. And I know how hard this is, but you want this, you do. You don't know what I want. No. Okay. I lost my leg less than a year ago. And I was scared and in pain, and I thought that I would never be able to do the things that I like to do anymore. But I did. Operated on you.
They send the cripple in to teach me how to live my life.
Okay. You can be scared and you can be pissed, and you can lie here like a garden slut till you die for all I care, but you will not become a monster that takes everyone down with them. You will treat people with kindness and respect, and you will start with yourself. And you will start by standing up, and you will do so by the time I count to 3, or I will drag your ass out of this bed. So, 1, 2, 3. Okay. You got it. All right, cool. Good. Wow.
no big either, baby.
No.
Okay, so, I mean, you obviously cannot yell at your patients like that and force them to get up. But I thought that was like a good opportunity to like see how she took that approach to, she started off by like trying to connect with her by talking about her own leg, and then obviously that approach didn't work. So just trying different things to connect with the teen patients that you do have could be beneficial for them to like help with, I'm at a loss for words, but you know what I'm trying to say. Okay, and then so some developmental considerations in healthcare interventions. So maintaining routines and life and normal activity as much as possible. So schedule and like routine is very important to our teen patients just because they do have a routine, and when they are in settings like this, it can kind of put them at a regression and they like don't do as much as they should. And then maintaining that peer relationship is going to be really important. Like I said, they do revolve around their teens and their peers, so it's really important to be able to have that communication with their peers and inviting them and like having them a part of their healthcare experience.
Tiffany to the cafe for one-on-ones, please. Tiffany to the cafe.
And then respecting their
for
choices and their privacy. When you're a teen, you don't like necessarily want a lot of people just barging into your room without warning, just kind of giving them like as much prep time as they can. Like if you're gonna go in and do therapy with them, maybe just go in a few minutes before and say, hey, we're gonna come and do therapy. There are gonna be so many people in here, just to give them time to like mentally prepare. And then encouraging open communication. If they have a concern, they should feel comfortable talking to you or a parent or a peer about like how they're feeling and kind of working through those stressors. Providing a detailed explanation and reasoning. Always letting them know like what's happening, tell them the truth, because they know when someone's not telling them the truth or when they're only getting half the story. So just kind of always be open and tell them as much truth as you can. And then recognizing their uniqueness and independence. Like everybody's different, not something that's gonna work for one isn't gonna work for the other. So always try and like get to know your patient and know like what's gonna work for them and then what would work for someone else. And then providing choices to promote control over their situation. Like I said, letting them have as much control as possible. So if they can pick certain things throughout their day, let them do that and let them have as like control, because it is their body and it is them, it's not you or their parents. So letting them have as much control as they can. And one size does not fit all, and then find what motivates them. If it's jamming out at their therapy session, let them jam out. Or if it's, you know, like watching a TV show while they do it or something depending on their therapy, let them do that. I know I have some other solutions in there, but maybe like if they're super competitive, like create a game out of it, or let them kind of make it their own therapy instead of you just going in and like making them do all these things. And then so age appropriate activities, I do have most of them on that like sheet that you guys can keep. But like a patient's personal cell phone is gonna be the most helpful way for them to stay connected. Like FaceTiming with their peers while they're here is gonna be important. Music, and then patient bingo is really fun if you make boxes and kind of sit down with the patient and like fill in the boxes of things that they like or their favorite sport, and then everyone who enters their room can kind of check off like if they have that in common. So like I love the St. Louis Blues, so I would put that on my sheet, and if any of you liked it, then you could like sign your name, and then they know that they have something in common with you and can make that connection. The drawing and journaling is a great way for self-expression. Even if they don't share it with you, sometimes if they write stuff down, they can like rip it up and throw it in the trash, and that could help them as well. Magazines and books, movies, like all these things are stuff that they do normally that they should try and incorporate while they're here, so they don't feel like they're at a total loss of what they have lost at home. And then adult coloring books, homework, scavenger hunts, arts and crafts, all that stuff is just stuff to let them kind of use self-expression and kind of go, like, eliminate some of those stressors that they may feel to act like a normal teen. Some responses you might see are uncooperativeness, loss of newly learned skills, and regression. I know you guys probably see that pretty often with them. Like in that video, I think throughout that episode, they tried different approaches with that patient, and then they finally found something that worked because she was like, I'm not doing this, like I can't do what I used to do now with this surgery. So maybe just trying to like find what works for them and then continue to use that. Dependence, they're gonna feel like they can't do what they used to be able to do when they're here just because they aren't the ones making all of the decisions. Like you probably still have to talk to mom about like certain things that they have to do just because they can't make those choices just yet by themselves. So that's gonna be something that you'll see. And then anxiety and depression, just kind of like not being in their normal routine, not being around the people that they're surrounded by all the time. So those are some things that you might see throughout their time here. And then mom knows best, like your parents are their best allies, they know their kids the best, so trying to incorporate the family as much as you possibly can, and maybe having a scheduled time to where you can meet with the mom and the dad and the patient and kind of figure out what's going to work for them. Planning is always good with those kids because then it sets them up for success and not necessarily a fail. And that's it. Does anybody have any questions?
Do you guys use a pediatric specific satisfaction survey?
No, we, I don't remember what happened. So we used to use PRC, and then we are now doing HCAPS.
Okay.
And I feel like there is a child one, but there's something, I don't feel, like I don't get access to that, and I'm trying to identify.
I didn't think HCAPs applied to anybody under 18,
And that could be why.
but the reason I ask is we use Prescaney. Prescaney they will send a survey for the parents to complete. They have to send it to the parent, not the child. But it doesn't have age-specific questions. So we have a it's a piece of paper that we give them on discharge for them to mail back. But the return rate last year was 1. And this year we've got 5. So I just wondered.
Have you considered doing it, like making it electronic and like providing them a tablet to do while they're here before they leave? You might see higher rates if you kind of set them up for the child to actually do it before they leave
Yeah, I
your
don't know
doors.
how I would do that though. So like, unless I did it as a survey monkey with the,
I feel like Manuel there would use Qualtrics a lot. Holly Henderson,
Holly Henderson.
and the medical librarian is like an expert on that. She'll
Okay.
help you.
Thank you.
Any more questions? Sorry if I talked really fast. I hope this information was helpful for you guys.
No.
Good, thank you.
Thank you for speeding it up because we do have several people that are crunched for time.
Patients are important.
We appreciate you coming very much.
And you guys can keep those handouts and give them
Thank
to
you.
other people.
Thank you.
I'll keep an original and then if you want to do your
Yep.
PowerPoint. And then what I'll do is I will print your PowerPoint and have it to the park surveyor and for joint commission. So that way they'll